What's up, you guys? It's your boy Miguel giving you the daily dose of radiation, and today we'll cover how homeless people end up at the emergency room like a lot, especially during the night times. That is where I work at a trauma 3 center here in my local town. We have a bunch of homeless people that be coming from time to time, especially during the winter time. And where I work at, it's kind of a situation where certain places, certain emergency rooms here, if someone comes, they can't deny treatment, which I work at the local city one. So anyone, no matter what kind of stage, no matter what, they had to be treated. Other hospitals, some people like that, they'll come and they'll be like, "Nah, we're not gonna treat you. Leave. We're not gonna deal with this," you know. But ours, everyone that comes in that door, they gotta be treated. So most of the time, they want just pain medicine. We've seen it time and again. They just want drugs. They just want somewhere they can sleep at, spend the night. It's happened many times. I've noticed that. Even the doctors, well, sometimes they'll do this is they have to legally do something to them to say they tried to kind of, take care of them. And the biggest thing they'll do is order just a chest X-ray on them and then just discharge them. It happens so much, and I'll catch myself. I'm like, why are we doing this? He's good. There's no reason to do this. And they'll always say that it is because of that. They just, even the doctor will come up to it yo, I need a reason to get rid of this person. Need a reason to discharge. Can you just, do a quick chest X-ray on them? And I'm like, I guess, but it's fucked up. It happens. So just be aware of that the homeless people will come and do that. Even outside of the hospital, I've noticed that we'll have the homeless people will complain that they'll hang out by our gas station or by it's not safe to walk outside of the hospital during these times. So that's something to keep in mind. Not so much when you arrive to work, but it's more so if you go out in the middle of the night for the patient's safety type of deal, I would say. But yeah, that's something, if you're a tech, of your students, keep an eye out to know. And it'll happen. Yeah, there's one time where we had a situation where the emergency room was so full that one of the people in the front was like, if we give you a cup of coffee, will you leave? And they're like, yes. And I was mind blown when I heard that story, because they literally just want something and they'll leave. Which, everyone deserves to be treated if you're in pain or if you're hurt or if you're injured. No one should be, like that. But there's certain people that come all the time that are homeless, and they just want drugs and they just want somewhere, But yeah, that is kind of the bad side of the hospital and stuff, but something, reality of the situation we face. And yeah, that's been your boy Miguel. See you on the next one.